If you fit most of these criteria, it's strongly recommended that you consult with a physician. It is imperative to know what impacts your health and what symptoms signal potential risks to your life. Diabetes can be difficult to detect because some of the symptoms are wide-ranging and not always obvious. Though the condition is often associated with weight issues, there are many other signs that can be overlooked. In addition to this list of 15 signs you might have diabetes, it is also prudent to note any weight fluctuations or dramatic drops in blood sugar levels after eating especially high-carbohydrate meals. 1. Fatigue. During an extended period of time, diabetes can make you feel tired even when you are eating a balanced diet and getting plenty of sleep. This is often attributed to poor blood circulation and poor kidney function. Sometimes low blood sugar levels can contribute to a feeling of being tired as well. 2. Blurry vision. Some people suffering from diabetes may notice that their vision is blurry or that it gets worse when they drink alcohol. This symptom could be attributed to nerve damage and high insulin levels in the body, which inhibit proper blood circulation in vital organs, including the eyes. 3. Numbness in the hands. People with diabetes often experience numbness and pain in their extremities, such as fingers and toes. This can interfere with a person's ability to use their hands properly. 4. Constantly feeling thirsty. Diabetes can cause dehydration because high blood sugar levels prevent the kidneys from properly filtering liquid out of the bloodstream and into urine. As a result, individuals with diabetes may feel chronically thirsty even when they are drinking enough fluids per day. 5. Frequent urination. During an extended period of time, diabetes will make you urinate more frequently than necessary to regulate your body's fluid levels. This is caused by the kidneys being unable to filter liquid efficiently out of the bloodstream and into urine. 6. Weakness in the legs. Individuals suffering from diabetes may feel weakness in their legs. This can make it difficult to walk or exercise without becoming tired. 7. Bad cuts and bruises. Sometimes high blood sugar levels can impact blood circulation and cause sores on your body that take longer to heal properly. This is often a result of nerve damage because high blood sugar levels inhibit proper circulation in vital organs, including muscles, nerves, and skin tissue. The result can be skin rashes, infections, sores, along with bad cuts or bruises that don't seem to go away as quickly as usual. 8. Increased hunger. People with diabetes often experience an increased appetite because the condition can cause dehydration and a drop in blood sugar levels after eating. As a result, they may consume more food than usual to regulate their energy levels. 9. Weight loss and increased thirst. In the beginning of being diabetic, you may experience weight loss and an extreme increase in thirst while urinating more frequently. This is caused by high blood sugar levels in the body after eating carbohydrates, which inhibits proper kidney function and causes insulin resistance to build up in the body. 10. Blisters on the feet. Blisters that won't go away and swollen feet can be a sign of diabetes in some individuals. This is caused by nerve damage and poor circulation in the extremities, which can cause poor blood flow to the skin's surface. 11. Heat sensitivity. People with diabetes may experience a difference in how they handle heat compared to those without the condition. When your body doesn't get a proper supply of insulin, you may feel like you are burning up when you are in fact just slightly warm. 12. Numbness in your hands or feet. As previously discussed, numbness and pain in your hands or feet could be an early warning sign of diabetes because it is related to blood circulation problems. 13. Frequent infections. High blood sugar levels can cause sores and other issues on your body that make it difficult to heal properly, especially when kept open by small items such as thorns or splinters. These incidents can cause infections, some of which may be serious. 14. Blurred vision with eye irritation. Some people suffering from diabetes may experience blurred vision along with redness and other symptoms related to their eyes. This is caused by nerve damage, poor circulation in the eyes, and high blood sugar levels after eating that inhibit proper kidney function and cause insulin resistance to build up in the body. 15. Frequent nausea or vomiting. Many people with diabetes experience nausea and vomiting after eating meals that contain high amounts of carbohydrates, especially complex ones like breads, pastas, and pastries. This is caused by insulin resistance. As a result, it's recommended that diabetics eat small portions of food frequently throughout the day in order to maintain a balanced supply of nutrients and energy. Bottom line: if you suffer from any of these symptoms or notice them suddenly appearing in your life within the last 6 months, it's strongly recommended that you consult with your doctor immediately to inquire about diabetes as an underlying cause during your next visit. Make sure to inform your doctor about any symptoms you may notice and ask them for a typical course of action for treating diabetes symptoms. One of the primary complications of diabetes is damage to blood vessels. Damage to the blood vessels may be caused by high blood sugar levels or poor blood circulation. Both high and low levels of glucose in the blood contribute to poor circulation. Damage to small blood vessels can lead to kidney problems because damaged kidney tissue can accumulate excessive amounts of fluid or form scar tissue. This can lead to high blood pressure and damage to other internal organs. In some cases, diabetes may cause heart disease. Heart disease is a condition in which the heart muscle begins to deteriorate due to repetitive stress or strain. If this occurs, the person will experience symptoms similar to those that occur with peripheral neuropathy, such as weakness in the legs and unpleasant tingling sensations. Diabetes can also lead to gastroparesis, which refers to delayed stomach emptying after meals that causes nausea and vomiting. It occurs when high blood sugar levels make it difficult for nerve impulses from the autonomic nervous system to stimulate the muscles of the stomach as they normally would. It can also occur because of gastrointestinal infections or the side effects of some medications. Another complication that is related to eye problems is diabetic retinopathy, which is the most frequent cause of blindness among young adults in North America today. It is caused by damage to the blood vessels in the eye, which may be a result of high blood sugar levels or poor circulation. Diabetes is known to cause clogging of capillaries in the retina, an organ that senses light and sends electrical impulses to the brain. This can lead to blindness if left untreated, although there are many treatments available today for diabetic retinopathy. We hope you loved all those tips for having a healthier life. Thanks for watching this video, and if you want more videos on how to boost your metabolism, make sure you subscribe so you don't miss out on future videos.